You can treat chlamydia. You can treat gonorrhea. You can treat syphilis. What's the problem?
Exactly.
Yeah. Herpes, that shit don't go
That
away.
one, no.
Yeah, that was also good.
Yeah, they got to come up with a herpes vaccine so that that one's not a problem.
Well, there's condoms.
I think
Oh,
that's
that's
Shut up.
disgusting.
It's because you're an idiot.
Oh my God.
He's a fucking idiot.
Well, so, Kevin.
Can you see herpes under a purple light?
No.
Oh, that would
No.
be fun.
That's a good question.
Yeah, if you could tell you were shedding,
Yeah.
that would be good. But
Yeah. Like on your cell phone, just flip your light on.
Yeah.
And go,
I mean, herpes really is, though, on the genitals, is just a cold sore on your genitals.
Mhm.
It shouldn't be as big of a deal as it is now. I remember Time magazine, long time ago, had the Scarlet Age. And that was when people were just starting to talk about herpes, publicly. And at the time, there wasn't any Valtrex or any of that kind of stuff. So it was a little bit of a problem. But still, unless you're pregnant and delivering a baby, that's when herpes is, herpes encephalitis is a problem. And people go, well, cold sores on the lip, that's no big deal, but that's herpes as well. And people think, oh, well, that's the good herpes. Herpes 1 is the good herpes, and herpes 2, genital herpes, is the bad herpes.
Mm-hmm.
But listen,
None of them are good.
Right. Well, herpes 1 is even worse. That's the one that causes herpes encephalitis in adults. So it's really worse.
Yeah.
Herpes 2 doesn't do shit.
Yeah.
It just gives you a cold sore on your genitals every once in a while.
Mm-hmm.
Now, if you get herpes 1 on your genitals, you most of the time will not have outbreaks like you do with herpes simplex 2,
Right.
because it doesn't like living in the genitals as much as it likes living in the mouth, and vice versa. So kind of interesting. They're trophic for those areas. They will live there if they have to, but they don't like it.
Right.
All right.
Well, good advice. I always told my kids that when they have sex, one, to wait till they get older, but if they decided not to, always do it with the lights on. And if it looks weird or smells weird,
Yeah, don't do it.
it is weird,
weird,
and
yeah.
don't have sex with it.
Yeah, right.
Mhm.
That's some good advice.
Yeah. Yeah. You're talking about the guy, right? Not
Well,
their genitals.
just
They
in
look
general.
weird and smell weird. It shouldn't be having sex
Well,
with them either.
Yeah,
And they
but
all
if their
smell
genitals
weird.
look weird
Right.
Yeah.
Well,
or smell weird,
every
stay away from it.
professional sex worker will tell you that they look at the male genitals before they'll let them, even with the condom on, put it in them.
Oh yeah.
And so we can learn from that.
Mhm.
you
And
know?
if you can't see it, don't bother.
Oh, you mean if it's
You can't see what?
well, if it's so small you can't see it? you
Oh,
mean, yeah,
it. Okay.
Yeah. If they have an innie,
Mm-mm.
God.
so
The wheels have officially come off.
oh, now you're being the whole
No, hell no. That's funny.
guys. Let's not
They
talk
need
about-
love too.
That's right.
All right. Have you guys heard anything about the 100-day cough?
No.
All right. I think I know what it is, but here's the question.
Hello, Fluid family.
Oh.
What do you know about this little thing coming through Texas that they're calling the 100-day cough?
It's
I've got several employees that have just had a ongoing, nagging, brutal cough.
yeah.
Sounds like RSV.
No, it's not. RSV won't cause a 100-day cough.
Yeah.
Can you think of
It'll linger.
Can you
yeah.
think of what would? Why do we have to keep renaming these things? There's nothing new.
Gosh, maybe COVID?
What
No,
about
not COVID.
pertussis?
Yes, ding, ding, ding,
Pertussis.
ding, ding.
Give thyself a
Oh
bell.
my God.
God.
You're amazing.
Yes, it's whooping cough.
Yeah,
That's what
okay.
they have. It's
Yeah.
it's
Oh, it's a school.
pertussis.
For-
If old Opie and Anthony listeners may remember when Anthony got whooping cough, and it was 6 weeks, and if Jimmy or Opie made him laugh, he would just get in these racking fits of coughing. And I advocated at that time that Sirius XM really should. Now, I'm not a mandate person when it comes to mRNA vaccines and stuff like that, for lots of reasons we've discussed. But there are reasons to sometimes mandate or strongly recommend certain vaccines, and the pertussis vaccine for adults is one of them. And when you've got a building well, it was 2 floors, but you got 2 floors full of people who are doing radio.
Yeah.
If you had pertussis sweep through there because it's extremely contagious, it would shut them down.
Yeah.
And of course, the health officer at SiriusXM didn't listen to me, and then they didn't have a pertussis outbreak, but they might someday if they don't, push that.
Mhm.
But that would be one, to me, would be something I would strongly recommend as an employer of people who are talking for a living, because it's with my lung thing. I sometimes get fits of coughing. I did a live stream last night. I had to stop in the middle of it because of that. And you could just imagine if you've got this. So anyway, pertussis is it's a Corynebacterium, right? Is that right? I think it is a Corynebacterium, and it is treatable. But the problem with look that one up, will you? And I feel like that's wrong. If you treat it with antibiotics, you'll kill the bacteria, but the cough doesn't go away. The inflammation gets set up. So it's way better to prevent disease by taking the vaccine. And it's in the DPT, diphtheria, tetanus, and pertussis. Does it say what bacteria causes pertussis? Melby, it looks like you found something.
The Bordetella.
Bordetella pertussis.
Yeah.
Oh, I was just going to tell you, don't do that.
Yeah.
Yeah,
I'm
don't.
sorry.
It's
It
okay.
fell.
I'll
I
fix
tried
it
to
later.
move it and it fell.
Yeah,
Sorry.
I know. You have to grab the cage, but it's okay. Who was here last week that did
Rain?
that? Yeah, Rain did the same thing. So you're in good company.
Okay.
All right. But anyway, yeah, Bordetella pertussis. Thank you. Corynebacteria is a different damn thing. That is that diphtheria? I don't even remember. Anyway, it doesn't
I
matter.
don't know, maybe.
It's been so long since I've done infectious disease that Corynebacterium. Oh yeah, diphtheria. There you go. All right. I'm not going to give myself a
Which
bell.
is all in the Tdap vaccine.
That
right?
is correct.
Yay.
Oh, that's why I've thought of that, isn't it?
Mhm.
Thank you. Anyway, yes. So 100-day cough is pertussis. Stop renaming these things, because what it does is it causes fear. The media does this,
Mhm.
where they'll go, "Oh, there's an outbreak of a new 100-day cough," and it's like, it's not new, and it's just because they're unvaccinated.
Yep.
Just shut up and stop trying to scare people by saying, "Oh, there's this new thing out there." People. It's almost like the weathermen. The weather person never gets to do that much. They are the jokey one, and they tell jokes, and then they tell you, what the temperature is outside, until there's a tornado or a polar vortex or a downdraft or something, and then that's when they shine, right? And they love it. And so sometimes I think they maybe make a bigger deal out of some things than they need to, because nobody's there to say, well, this is bullshit, because they are the meteorologist, and I'm not saying all TV meteorologists do this, but I think some do, and I've seen them do it. So, and I used to work in TV. I've seen it. But it's the same kind of thing, is that there's no infectious disease news right now. So there are some people that honed their craft and got their chops reporting on COVID, and now there's a whole lot going on. So now we invent the 100-day cough.
There you go.
But it's nothing new, or they don't know any better, and that's just as bad, if not worse. If you're going to be reporting on this, just say, hey, there's a pertussis outbreak. If you want to report on it at all, what's the big deal? Unless you want to encourage people to get the vaccine. Okay. All right. Here's a good one for Dr. Scott.
Hey, Dr. Steve, it's Albert from Albuquerque.
Hey,
How
Albert.
you doing?
Good, man. How are you?
Great.
Good.
Hope everybody else is doing good there too.
Oh, yeah.
Hey, listen, I got a quick question. My siblings have recently seen an article or seen a video on grounding, providing a better than normal ground to the earth as a anti-inflammatory and all sorts of health benefits type things. And it's done via a bed sheet.
Okay. So at first I was like, okay, if they're ham radio operators, yes, you need to ground your radios in an excellent ground. I can talk about that, how to create a good earth ground that you can tie everything to, so you don't get ground loop, noise and stuff like that. No, that's not what they're talking about. They're talking about taking your mattress and grounding it to earth ground. And not only that, they're not really using earth ground. They're using the floating ground. You're just plugging it in the wall and using the electrical ground of your house.
It's grounded. Hopefully your house is grounded.
Hopefully, but sometimes they
appropriately,
float.
yes.
But anyway,
They lay on that's plugged into the grounding outlet or grounding stud of an outlet.
if you're really going to do this, run a grounding wire to the outside. I can teach you how to do that. It's not, you want a big giant copper rod
and you wrap it around the big
Stop.
copper rod that's driven into the dirt.
That's
Oh,
right. You want it
talk
driven
slower.
deeply into the dirt. Yeah, ram that rod
Copper
deep
rod
into the dirt.
dug
Deep.
Mm.
Lady Diagnosis
Oh,
likes
sorry.
rods driven into the dirt. I don't want to know anymore.
Your house ground. The curious thing to me would be, I don't know what the potential of the ground is between the sheet and that
Right.
connection. But I'm curious from your perspective and Dr. Scott's perspective with that wacky Chinese stuff, is there any validity to this? NIH had a study, a very small study on wound healing,
Right.
and it seemed to accelerate wound health or wound regrowth.
Right. So the answer is that study, I think if we're talking about the same study, had 20 people in it. So it wasn't large enough study to prove anything. So if I could do like 10 studies with 10 people and then just pick the one that has some, statistically shows some benefit. But I say, oh, this study was too small to show statistical benefit. But you could publish it and take the other 9 sets of data and throw it away. It's very unethical. It's called p-hacking. And it's where you're looking for p-values being an indicator of statistical significance. So a p of less than 0.05 means that 5 times out of 100, this thing would be due to chance. And we figure that that's a good enough, it's called 5 sigma. And that's a decent statistical significance. That's what we look for. That's the level. And so I could do a study, like I said, 9 studies of 20 people. Take one of them where statistically I just had an improvement, or the people healed their wounds faster than the other, the control group, and I'll publish that one, throw all the other studies away. Now, if I pooled all that data, because I did 9 identical studies and only took the data that I liked, if I pooled all of that, I'm going to basically guarantee you that there's no statistically significant difference between the two. Now, this is an easy study to do. If you are selling grounded mattresses, just do the freaking study and do it correctly. Don't give us this bullshit, 20 people study. Do a real study. Take 1,000 people and give 500 of them your mattress, matched cohorts, 500 a mattress. When they plug it in, it doesn't actually make a connection to ground. And then show me that there's a statistically significant difference in whatever endpoint you decide, whether it's wound healing, sexual, gratification, or whatever, because they claim all kinds of stuff. But we are designed to float above ground. We are sacks of meat that usually are not grounded, and they'll say that's bad. I say that's a normal status for us. We do have electrical circuits in our body, but we don't want to ground them. We want them to be active. So, and when you shuffle your feet on a carpet and then get a shock, that's basically you're building up electrons on one side of that equation and transferring it rapidly to the other, and that's what makes that spark. And that's what they say on this, is that you were doing this so that you could more readily exchange electrons with ground. Shut up. That's like, did you ever get trained in therapeutic touch?
No.
Okay, so that is a nursing intervention where they just wave their hands over the patient and they don't actually touch them. And what they'll say is that they are manipulating bioenergy fields. It's like, why are you making up things. Just say that the process of doing it makes people feel better, if it does, because it does. You're paying attention to people. People like that. They like being recognized. They like being paid attention to, and it makes them feel better. And you don't have to make up some phony baloney mechanism for it. It's enough to say that doing this process makes people feel better, and we don't know why.
Well, I think the heat of the hands can
A
stimulate
foot above the
energy.
patient. Fuck off.
It's not a foot above. Isn't like Reiki kind of like
Foot
that?
above.
I've seen them
Yeah.
where the
'Cause
patient's
they-
laying in the bed and they're just like doing like this, manipulating. Yeah,
Huh.
6 inches to
Okay.
a foot.
Dr. Steve, you have so much to learn in this.
Well, no, get out of here. Okay,
My hands are.
I am willing.
My hand.
I am.
They're cold.
I could do it right now.
I
You
am
can.
willing.
feel
I
it.
know.
Hands are
I've
always
done
cold.
that too, where you
You can
move your
feel it.
hands and you feel the
feel it.
ball of energy and all this
Right.
stuff.
Isn't that called being a mom?
There is real physiologic reasons why you have that perception, but I'm willing, that notwithstanding, willing to be convinced that they are actually manipulating a bioenergy field. All they have to do is show it to me, measure it before and after, show me that it changed because you waved your hands over them. And I'm not just talking about therapeutic touch. I'm not just crapping on that. There's all kinds of these maneuvers where they say they're manipulating bioenergy fields.
Well, what they did that under microscopy, where the monks actually prayed over molecules of water,
Yeah, I remember. you
and
talking
they actually
about that.
changed the molecular structure of the water of the ones they prayed over. Now, that is,
Amazing.
science, and it's proven that you can do. The thing is, I think that, and Steve's right to a certain point. A lot of it is placebo.
Mhm.
Somebody feels like you're
And that's
doing.
fine.
Oh yeah, no, I agree. Yeah, a
I have
lot of
no
it is,
problem with that.
but a lot of it is if they have faith in what you're doing, you can help them for sure.
Mhm.
And if you have your best heart, and I know him, and I've seen him in clinic, 1,000 times, he's going to have a better outcome than most anybody, just because when he walks into, people feel better. They feel like he cares, and that's vital. When you're talking about, can you
There's
Yeah.
he's got a good point,
Yeah.
and not just about me, but if you have a shit bedside manner,
Yeah.
people are not going to feel better,
No,
and when they get angry, they feel worse.
they're
So,
getting worse.
Mhm.
Yeah. So I do believe there are some studies. I mean, if you did maybe some thermal imaging of someone's hands,
right,
that says they're doing some qigong stuff, I believe you could see some changes.
right.
Possibly. I don't know.
I don't know. Well, I'm going to tell you this. I'm fine with the placebo effect. I even wrote an editorial, decrying the making up of things like that. Don't make stuff up. But if you don't like the term placebo, because people go, "Oh, yours works by the placebo effect," people will go, "Oh, no, it does not. It has, and it's like, it's okay. The placebo effect is so powerful
Huge.
that we have to subtract it from
Yes.
every single study that we ever do. So how about this? Let's not call it the placebo effect. If you think that is a pejorative connotation, call it the cryptogenic therapeutic effect. And then you don't have to make up anything. You just say, my technique works by the cryptogenic therapeutic effect. And you're not saying placebo, even though the two are synonymous. But you're not saying placebo, and you don't have to feel like you're minimizing what you're doing. Because if it makes people feel better, I'm not going to minimize it.
No.
I always sent people to Dr. Scott when he and I first started working together, because I had people that I had ruled out that they had anything was going to kill them, but they felt like shit. And I'd send them to him, and they'd always feel better. So I don't care if his ninth meridian, third pulse stuff is bullshit or if it's real. It doesn't matter. It works,
Mhm.
and